Now, I was actually reading about cervical cancer, and I saw one thing where they actually made mention of early coitarche. All right. So for the early coitarche, I now picked interest in it. I'll just say, "Kai, let me just describe it, okay?" Because the risks of starting to have sex at a very early age, there could be so many complications, okay? That probably maybe the complications are not only cervical cancer. So let's describe it. So early coitarche just simply refers to onset of first sexual intercourse at a young age, okay? Typically during adolescence, okay? So the term is used in medical textbooks, psychological textbooks. So we're not here to now describe about, just talk about some crazy things. Okay, we're here to learn. So health implications, which is the most important reason why I'm making this video, okay? This thing could actually have a lot of implications, okay, on the young girl. So there's increased risk of the young girl having sexually transmitted infections because at that early age, she's having sex with people that are so much advanced in sex life. They have had contacts with older women and all of that. There's higher rate of unintended pregnancy because such people don't really have the knowledge of using contraceptives more. They don't even really know what they want in life in the first place. Potential for emotional and psychological impact, okay? So most of them, it affects them for life, okay? So associated factors, socioeconomic status, are things that could actually push the girl to having sex early. So socioeconomic status, peer pressure, media influence, okay? Just like you have a lot of big TV companies right now promoting sex here and there, Maybe lack of comprehensive sexual education. Maybe the family members are not really talking to her about sex and all of that. So you have to be open to children. Family dynamics and how the parents are giving attention to them. Cultural norms and early marriage practice. So in some places it's normal, right? People getting pregnant very early on in life is normal. So long-term outcomes is if you start sex early, there's now a higher possibility that you have a lot of lifetime sexual partners. That's what high body counts, right? Increased use of cervical cancer, then lower education attainment, okay? Some girls, when they start sex early, they just feel like life revolves around them, okay? So they might not actually chase life like that. Then they end up, they call them expired, you understand? So that's when they now start, bouncing back on life, and sometimes it's usually late, okay? So those are the various issues around, this early coitarche.